Hello, my name's Phil Kane. I'm a journalist specialised in covering alcohol. And this month, like last month, I've arranged an event to discuss the way alcohol is treated during the coronavirus outbreak. It's been treated very differently in different places. In the UK, for instance, it's been deemed an essential product. In South Africa, its sale has been made illegal. So, what are the pros and cons of these different approaches? I've invited on two experts from these two different places to discuss this issue. The first is Ian Hamilton from York University.
I'm up at the University of York. I'm also a mental health nurse, and I've been working with people who have drug and alcohol problems for 25 years now. So I've put in both camps. Not a sneaky way of saying I know what I'm talking about. I've been doing it a long time, really. But when it comes to alcohol, I don't plan on talking for that long because, like you, I'm really interested to hear what Charles has got to say. I just thought I'd briefly outline what I've seen so far over the last, how long has it been? 2 months, really, just tracking through COVID and just watching how things play out, really. And I guess the first thing that kind of alerted me to what might be going on is we had some retail sales figures published in the UK that showed there'd been an uptick in the sales of alcohol. So these are retail sales. They obviously don't include alcohol sold through restaurants or pubs because they're closed. So although we've seen an uptick, a really significant uptick in sales of alcohol, that could be offset by people not buying alcohol in pubs and restaurants, of course. So that was interesting in itself. But then a couple of weeks later, Alcohol Change, who I'm affiliated with in the UK, commissioned a survey of people who are drinking. And what they found in brief was, the way I would interpret it, is they found two broad camps. What they found was that people who were drinking moderately prior to COVID continued to drink moderately or reported being abstinent since COVID began. However, those that were drinking at what we deem risky levels, high risk levels, prior to COVID, had started drinking more or reported drinking more. So that's just another bit of data with all the caveats that you would normally have around survey data. That again just got me thinking a little bit as to what might be going on here in the UK anyway. Excuse me. Added to that, of course, is the political dimension or the industry dimension, and the fact that the alcohol industry had pushed or lobbied that alcohol retailers should be deemed essential in the same way that pharmacists should be, or are rather, in the UK. So I thought that was quite interesting. I guess putting all this together, where I thought I would leave you with is it's been quite noticeable, excuse me, how quiet our political leaders in the UK have been around alcohol. And I appreciate they've got a lot of other things on their plate at the moment, but it feels to me, that's not very scientific, but it feels to me as though we've almost had a suspension of any public health messaging around alcohol. So as you know, in the UK, the current recommendation is that you shouldn't drink any more than 14 units of alcohol a week, that you should have 2 dry days a week, and that should happen obviously all the way throughout the year, pandemic or not. But my impression is that our government is viewing alcohol as a liberal notion. It's certainly not one they want to start even whispering about in terms of being seen to restrict people's few enjoyments and pleasures, as I've heard it said, during lockdown and restricted access to people and pleasure, as it were. So that's my take. I think there's more that I could add, but I feel like I'm preaching to not the converted, but the experts. So I think you know far more about this than I do, but that's just my view for what it's worth. I'm happy to hand over to Charles or to Phil or whoever wants to chip in at this point.
If I may, we could do a little bit of a round of questions. I know you're kind of being very modest about your own insight, but I think you've probably given this more concentrated thought than many. There's a kind of mismatch, I think you've noticed between what the WHO is saying about alcohol, which is essentially that it's not a helpful thing in this situation, and the idea of alcohol as an essential product. And I guess this is not unique to the UK, the US, and Australia, and many other friends. I think it's obviously South Africa is a rarity in having made it inessential. Now, I wonder whether there is really a criteria one could use to change the status of alcohol in a way, which would be more helpful. I mean, is it essential, inessential, or is it something in the middle? Is there some sort of middle road that you think could be trod?
Are you addressing that to me, Phil, or to everyone?
Yes, yeah.
Oh, sorry. Well, I mean, it is essential for people that are dependent. That's the other thing to say. I wouldn't want alcohol to be abruptly withdrawn from people who are physically dependent. Obviously, it could kill them. But clearly, for the rest of us, if I can put us all in that category, of moderate drinkers, it's clearly not essential. And of course, you intimated the other aspect to this is the myth that somehow drinking alcohol protects you from COVID. I think that's been dealt with now. Early on in COVID, that was kind of going around social media, and of course we've got to remember some people only access information via social media. Well, probably include myself in that. I read a lot on social media. I'm not sure how much I read outside of it, so I'm not trying to be snobby, but it's just that's the world we're in, where it's not just about stuff going viral, it's just about the information you access and how credible you view that to be.
Yeah, I mean, I think I'm maybe looking at it in a almost sort of philosophical way. I mean, there are things I buy from the supermarket which don't include alcohol, but which, I don't know, herbs or spices, or they're not providing me with sort of nutritional parts of my diet. Nevertheless, I mean, life would really seem a lot poorer without it. I suppose there are people who consume alcohol who think of it maybe in that context as something which is not sort of physically essential, but somehow as part of maintaining a reasonable quality of life is an essential product. And those people don't have a problem with alcohol. They're not actually harmed by the substance. As you said, they're moderate drinkers. It's not doing them any harm any more than a pinch of oregano is doing them any harm. So I just wondered how you handle that situation. There's almost a paradoxical situation going on there.
There is, and it's this idea of there being two groups, really. So I'm not particularly concerned with people who were picked up in the alcohol change survey who said they were drinking moderately. And I mean, I also think this is a class thing. I think these people are also enhancing their lives and enriching their lives in other ways during lockdown, learning Spanish, learning to play the violin, and drinking less. But that leaves a rump of the population who I think have pretty much been ignored. As a clinician, what worries me in this is that I'm hearing that our frontline services, specialist alcohol treatment services, weren't particularly in root health before this pandemic began, and they're really struggling at the moment because of referrals, but also because their frontline staff, some of whom are nurses, are obviously redeployed into the NHS. So I don't think our support services are in a fit state at the moment to be dealing with business as usual, never mind amplified or a surge in demand.
Mm-hmm, mm-hmm. I'll ask one last question, then I will put it out to everybody else, which, as I said before, you just need to switch your camera on and give some visual indication, whatever it might be, a hand in the air or thumb in the air or whatever. So one quick question. One of the grey areas and one of the sort of bits of the puzzle we couldn't really answer last time necessarily because it was so early on in the situation was what happens to the people who are dependent on alcohol in a medical sense, and whether or not they would be left high and dry without access to the resources that might help them deal with alcohol dependency within a socially transformed situation. I just wondered from your sort of day-to-day experience, how that situation has played out. Are there people who are really left very much to their own devices and suffering?
Definitely are, and in some ways, more visible you are with your alcohol problem. I.e., if you're a street drinker, if you're homeless, if you're a prisoner or new into prison, etc., etc., then I think services are struggling. But I think that those people are relatively easy to find. The ones I'm really concerned about are the ones who are alcohol dependent but don't identify as such. And when we've seen, people being furloughed, so in other words, outside of the UK, people who are being sent home, some of whom don't have any salary, there is a risk that they will abruptly withdraw from alcohol, and they have no means. Really interesting report on the BBC this morning online show the as you would expect, the way inequality is playing out in this whole pandemic. So very briefly, no great shock, but those communities that are the most socially disadvantaged are bearing the brunt of COVID in terms of infection rate and mortality. And I would also expect those same communities have the highest density of people who are struggling with alcohol. So they don't have the means like you and I do to keep drinking.
Mm-hmm. Mm-hmm. Okay, I will resist the temptation to pepper in with more of my questions. So if you want to ask a question, if you can switch on your video so that my colleague Ben can sort of pick you out and wave a hand, and he will pick somebody out more or less at random from those here. So just make yourself kind of visually obvious to my colleague, and he can pick you out. Don't be shy. Do we have anybody wish to ask? There we go. Elena. Hello, Elena. Far away, you're on.
Hi, Elena Smith. I'm a health improvement lead for alcohol licensing with NHS Greater Glasgow and Clyde. I cover Glasgow and Renfrewshire areas, and it's interesting, Ian, that you comment about how there hasn't been a strong public health comment in relation to alcohol. We're quite fortunate that obviously in Scotland there is a slightly different take on it, and there's been at least 3 episodes during the daily briefing from the First Minister where the interim Chief Medical Officer has made comment in relation to alcohol and not using it as an excuse to actually drink more. We're obviously hearing comments back about people living in permanent weekend mode, but on the other side of it, I'm also hearing good comments from our addictions team about how they're managing to do a bit of support in relation to doing a home detox over the phone, which they never thought they would have been able to actually do. So there's the good points and bad points, and I think it's about, I'm sure the Scottish Government has taken a measured approach as to they have a very strong policy in relation to alcohol, and they don't want to lose that. We've obviously got this period where we should have been reporting on minimum unit pricing and its impact, and obviously that's now going to be postponed, I assume. But in the meantime, they want to make sure that we're not losing the benefits of what has actually gone on in the last 2 years. So that was just my comment, and wondered if anybody else had anything to add.
So yeah, I think yeah. Ian,
Really
do you have a comment on that, Sam?
I think that's really helpful, Elena. It's I think the devolved governments are often, not just with alcohol, but in many aspects of health, leading the way. And there's I don't know what that's about. I don't know whether it's just the politicians are people, aren't they? And whether it's the people, or whether there is a bit of me worries about industry influence, and whether the Scottish Government is a bit more immune to that. They've obviously fought the minimum unit pricing policy really hard, and all credit to them for that. I don't want to get into conspiracy theories and start getting all weird about it, but I think it's interesting. Whether who knows tonight. Matt Hancock may stand up in the daily briefing and say something about it, but I'll the book's behind me if that happens.
Okay, I think Ben Jardine has figured out how to do a software a raised hand, which I presume he means. There we go.
Oh, sorry.
Thanks, Phil. Yeah, I wanted to come in to maybe develop a little bit of what Elena said there about the difference in Scotland. And I'm also very aware that I don't want to in any way, point out the differences, as the First Minister stated again this morning, in any sense to emphasise the political divergence, across the Scottish and English border. However, one of the main political differences that made an effect was that the Public Health Minister and Chief Medical Officer went further to actually issue a letter explaining to all health boards, health trusts, that substance misuse workers were not to be redeployed in any way. Mm. I really note your comments about the state of alcohol provision before the COVID-19 episode, and Peter talked about that at our last meeting, that the erosion over the years of effective intervention and support for people. I think with that in mind, and the view within Scottish Government and within public health in Scotland, and emanating out into the third sector as well as statutory services, that substance misuse in general, alcohol in particular, are areas that require particular and essential attention. On the flip side of that, some of the anecdotal evidence I've received about the situation where off licenses in Scotland are opened as essential services. That has led, in some cases, to individual police officers stopping, occasionally fining people because all they have bought is alcohol. Now, at the moment, my assumption there is that the communication has not radiated outwards. But I did hear Alison Douglas from Alcohol Focus Scotland say that she wasn't particularly satisfied when she raised this with Police Scotland. She got a rather vague response, and she would really be expecting a more detailed response as to what was happening there. So I think all of this is evidence of, maybe Scotland has addressed the health implications in a way that hasn't happened throughout the UK, or may have happened in other parts of the UK, but we still have problems around, the whole system approach, being able to adopt a consistent approach.
Mm-hmm. Thanks. Yeah, thanks for that. That's useful detail. I'm not as familiar with what's happening in Scotland, but it does seem, particularly to contrast with what's happening in England.
Mm-hmm. Okay, I think we've got a bit of a starting point for the sort of UK angle of the discussion. So the fresh ingredient, I think, to many people, although I do see there are a number of people with names which I suspect hail from South. So I will introduce Charles Perry, who's a director of alcohol and tobacco and other substance use in Cape Town in South Africa, where the approach has been somewhat different, let's say. But I shall let Charles introduce us to the differences himself.
Thanks, Phil. I presume you can all hear me?
I can
put up a slide here quickly. Let's see if that works. Can you see the slide?
Yes.
Great. Okay, well, thanks very much. This is really fascinating to have this sort of north-south dialogue, as Phil said, and there are the issues to pick up on, particularly the issue of one size fits all and the inequalities in society is something that we're noticing here. certainly a big issue. We can pick up maybe during the questions and after my presentation. As you said, I head up the alcohol, tobacco, and other drug research use at the unit at the South African Medical Research Council. I consider myself an epidemiologist, policy analyst. I'm going to be covering the topics. You can see I was given 20 minutes. I don't know if I'll need all that time. I'll give a little bit of background on the drinking context in South Africa. Then I'll talk about the alcohol-related provisions as part of the state of disaster regulations that are an evolving process in South Africa. Initial consequences and the effects of the lockdown and on alcohol use particularly, and crime and violence and injury. I'm going to talk a bit about an ongoing legal challenge by the Gauteng Liquor Forum. It's one of our provinces. It's a part of the liquor sector. I'll explain that. They're challenging the president in terms of the provisions. That's an ongoing legal issue. Talk a bit more about that. And then I've got some concluding thoughts around how we're doing things differently in South Africa and where it might lead us in the future around alcohol control measures. It's an opportunity. So let me start there. So in terms of the background, I don't have any slides at the beginning, but they come in later. According to the World Health Organization, about 31% of the population, adult population, drink alcohol. I think that's a gross underestimate. It's probably 40 to 50% of the adult population drink alcohol, but we know that many people aren't always honest about their drinking. But we do know that also according to the World Health Organization, and our own data supports this, that they found that about 59% of drinkers engage in heavy episodic drinking. So while many people don't drink, a large proportion of the drinkers are drinking extremely heavily, particularly over weekends. And that translates to perhaps as many as sort of 20% of the whole adult population are heavy drinkers. And then 30% are light drinkers, and then 50% don't drink. So the whole industry is really predicated upon a small group of people, a relatively small proportion, who are drinking very heavily. And that obviously has huge consequences to society, and I think also plays into the government's response at this time. We also know, I'm just going through a few statistics here at the beginning, that alcohol is the 5th largest risk factor for death and disability in South Africa. And it's mainly due to the link between drinking and violence, injury, as well as communicable diseases such as tuberculosis and HIV. Our own research has shown that approximately 170 people per day die from alcohol-related causes. We have a population of about 60 million people. And about 60% of the alcohol attributable deaths occur in the lowest 30% of the socioeconomic distribution. So the burden is much higher there, even though more people from the higher SES levels drink. Alcohol is very cheap. It's about 47 pence for a 750 milliliter, that's 3/4 of a liter of beer in the store. So obviously it's more expensive in bars and so on. We have industry self-regulation of marketing, which is very weak. A high proportion, perhaps even as many as 80% of our liquor outlets for on-consumption are unregulated. That's also a huge issue. We have beer now sold in 1 liter containers, which makes it much cheaper. And that's obviously where most of the poorer sectors of the population are getting their alcohol. About 56% of the absolute alcohol consumed is beer. And it's debatable, but about 10% or so is sort of informal alcohol. What we call shebeens, which are sort of informal liquor outlets or community bars, are important places of recreation for people living in crowded communities. They're often open for very long periods of time, and they can be, although not all of them, obviously, sites for interpersonal violence and risky sexual behavior. So what were the alcohol-related interventions as part of the state of disaster regulations? On the 18th of March, so we're a little bit behind, later than what happened in the UK, we implemented what we call lockdown light for a period of 8 days before the full lockdown was implemented. And in terms of alcohol sales, both on and off consumption outlets had more restrictive hours. So they were not allowed, they had to close at 6 p.m. at nighttime, and they could only open at 9 o'clock the next day. And on Saturdays and Sundays, on Sundays and public holidays, they had to close at 1 o'clock. For on-consumption outlets, they could only operate if they had fewer than 50 people in the venue, and they were encouraged to have social distancing. But many of the outlets are quite small, so 50 people would be bigger than the whole outlet. So it wasn't necessarily that clear what was required there. But in terms of large restaurants, if they were going to sell alcohol after 6 o'clock at night, well, up to 6 o'clock at night, they could only have 50 people. Then at midnight on Thursday, the 26th of March, we had the implementation of a full lockdown to prevent the to curtail the spread of the virus in South Africa. We now have about 3,500 people testing positive and about 75 deaths. So it's still quite low compared to the UK, but obviously the curve is growing, and we implemented our interventions quite early. So at midnight from the 26th, Thursday the 26th, which is 5 weeks ago, we implemented a 21-day period of lockdown, which was then extended for another 2 weeks, which placed a complete ban on all sales of alcohol, from online sales, on-consumption sales, and off sales. No alcohol was allowed to be sold. Obviously, many people who could purchased alcohol in advance, but many people obviously lived more from hand to mouth, and so they weren't able necessarily to purchase in advance. The lockdown provisions also prevent the transportation of liquor. So you can't take it in your house and go somewhere else. If you're caught with liquor in your vehicle, that's an offense. We have 20,000 police and currently 73,000 army on the streets. Lots of roadblocks. People report often being stopped at roadblocks. The main reason given for the alcohol provision really was that it was shown, and this was the Minister of Police was very vocal here, not the Health Ministry, that saying that a lot of crime is related to alcohol, and the sentiment was that we didn't need our hospitals filled with alcohol-related trauma, and that was the main provision given. But I suspect another reason was that it was felt that many people drink socially, in communally, they share containers, and it was felt that allowing alcohol sales in any form would promote, would be against the social distancing, which was felt was needed to control the spread of the virus. So what were some of the immediate consequences of the lockdown light period, which was a period of sort of 8 days? Anecdotal evidence of a drop in trauma unit admissions, and a reduction in ambulance call-outs. In terms of the lockdown itself, the police minister went spoke on the media after the first week of the lockdown, and he gave the following statistics. For example, murder in South Africa, across the country, rates dropped from 326 in a year before for the same week to 94. Rapes dropped from 699 a year ago to 101. Assaults with grievous bodily harm from 2,673 to 456, and robberies from 8,853 in that week in March, early April, to 2,098. So a 25% drop. There was also a big drop in non-natural deaths, and I'm going to show a slide here. This is data which came out from the Medical Research Council, where the black line, you can see the drop from February 26, 2020 to 8th of April, 2020. And it's about a 64% drop, but there's normally a drop at that time of year. So when we look at the same period a year ago, we had about 815 people dying of non-natural causes a week to 400 per week. So differing how you look at it, but substantial drop in deaths. But then what other things did we see? We saw, and I've just got a slide here, we saw a growth in illegal sales and black markets. Many of the liquor outlets started selling sort of out the back door. And we got to see how much alcohol, in fact, is being sold. 500,000 rands worth, which is 500,000, was confiscated from a small outlet in an informal settlement in Cape Town. So it's clearly huge business. They were caught selling alcohol, so the police confiscated all of their stock. We've seen numerous examples of looting of outlets, but that seemed to be more in the first week of the lockdown. And I know that there were at one stage 16 liquor outlets, I think in Cape Town, which were broken into because of the people, for various reasons, which I'll get to in a minute. We've also seen, interesting, this was a comment in a Sunday newspaper, some very enterprising person started drone sales of alcohol to people's houses. It's a whole piece that I won't get into. And we also heard there was selling in the townships home brewing and police confiscating people home brewing. And more recently in the more wealthy suburbs, here was an advert. Well, in fact, this was a picture taken at a supermarket in a more upmarket area showing selling pineapples, which people could use for brewing pineapple beer. And they're also selling quite conveniently brown sugar and yeast, because many people are searching now online for how do they make their own. Because after 5 weeks of lockdown, many people are running out of their own stock and they can't buy it. So now, people are starting to get involved in home brewing, but we don't know how widespread that is. There's talk of a loss of government tax revenues, but then we also know from public health side that oftentimes the economic costs to countries are substantially more than we get in tax revenue. And there's also been claims about the loss in sales for people in the liquor trade. There's been a pushback from an organization called the South African Drug Initiative, which is usually concerned more with heroin addicts getting access to treatment and methadone. They came onto the cause, got a lot of space in the media saying we should really open up alcohol sales for everybody because there are many people suffering from withdrawal. Public reaction has been quite mixed, but there's been quite a lot of support, I would say, for the government taking quite a strong stand on not selling liquor in this country. And even some key radio commentators have been quite supportive of the government's efforts around alcohol, but less so around tobacco, because we have also no sales of tobacco during this lockdown period. Many people say that the middle class, there are people in the middle class mocking it and saying it's unfair that they can't restock, and others saying that, there are inequalities because the middle class were able to stock up before and now the poor people can't. But we continue to see advertising. I don't know if this is happening in the UK. The liquor industry is not generally engaged in widespread marketing of their products, which can't be sold, but they are trying to show their solidarity with the government lockdown, what government's trying to do to flatten the curve, but yet their online sort of pictures are showing sites of bars and people brewing and things like that. So it's a bit of a mixed message. They're trying to show themselves as responsible corporate citizens, yet they are still marketing in the background. Moving on, the legal challenge by the Gauteng Liquor Forum. Gauteng is it's got the largest population in South Africa. It's around the cities of Johannesburg and Pretoria. The Gauteng Liquor Forum comprises supposedly about 20,000 small liquor traders, many of whom are unregulated. They are shebenas, tavern owners in townships, and they initiated a legal challenge. We don't know, although I suspect the large liquor manufacturers are also supporting him in this challenge, but we haven't got any information about that. Over the Easter weekend, the lawyers for the Gauteng Liquor Forum they wrote to President Ramaphosa, threatening to take him to the Constitutional Court unless there was a relaxation of the lockdown regulations pertaining to the sale of alcohol. And they said basically, we want to be able to sell alcohol for limited time of day from 9 o'clock to 6 o'clock. We will practice responsible distancing for people as they queue up, and we will also place limits on the amount of alcohol they can consume. At that time, I was contacted by two government officials. One was from the Department of Health, and the other was a special advisor to the Minister for Cooperative Governance and Traditional Affairs, and asked to give some assistance to them in preparing the government's response to this legal challenge. So basically, my response was to share, initially, to share 4 ways in which I felt that they could push back against the legal challenge by the Gauteng Liquor Forum, and 4 other ways in which I think they should rebut what I presume to be industry counter-arguments. And let me just present those very briefly, because I know time is running on. I felt that they could make a case that heavy drinking weakens the immune system. And I won't go into the details here, but essentially we know that earlier lung damage from heavy drinking can worsen outcomes after what we call a secondary insult. So if you are infected with COVID-19 and it results in a respiratory infection, the fact that you already have a damage to your lung from heavy drinking, which you might not know about, actually can worsen the outcome. Secondly, I said, and I made a case that drinking, and particularly heavy drinking, is going to work against social distancing or physical distancing efforts, because we know many people in poorer communities in South Africa live in crowded situations, and even if they can buy their alcohol from off-consumption outlets, they'll come back home, they'll have a few drinks, and then after they've had a few drinks, alcohol is a disinhibitor. They may get some challenges for starting to drink again from their partners, and they'll go outside to their neighbors who live very closely, and we suspect that they will start drinking communally. They would have bought these 1 liter bottles of beer in all likelihood, and they will start sharing. And that will have a couple of consequences. Not only will it increase the likelihood of transmission, but it could also increase the opportunities for interpersonal violence, which we know happens in those close drinking environments, and particularly if alcohol is scarce and there are fights over limited quantities. For those who don't go out and they drink at home, they bring alcohol into already what's quite a tense situation. These people aren't living in quite large houses like you or I. They're very small, crowded conditions with perhaps many children. There's economic hardships. They'll bring the alcohol into that, and often that can precipitate gender-based violence, harm to children, and even self-harm, because it's a very tense, difficult situation to be living in. I also made the point that by reducing the availability of alcohol, we're potentially freeing up hospital and especially trauma unit resources to be used to treat COVID-19 patients. We know that we have about 40 to 50% of our people coming to trauma units come there because of injuries linked to heavy alcohol consumption. Either the perpetrator or the victim has been drinking. So by turning off the taps to alcohol, we'll reduce the numbers of people coming to the trauma units. And I can go into this in more detail later if people want, but I then developed a computer simulation models with colleagues, epidemiologists and trauma unit specialists, surgeons from around the country. And we basically did some modeling, and we found out that we have about 35,000 people coming to trauma units each week across about 400 hospitals. We're seeing about a 65% reduction in the number of people coming to our trauma units because of the lockdown provisions. They may be related to fewer cars on the road, related to alcohol, and so forth. Then we calculated that on a given week, we probably have about 9,000 less people coming to trauma units with alcohol-related trauma. And we did some modeling, and we reckoned that if you turn on the taps again, you'll probably get about 5,000 of those 9,000 coming back each week, which places quite a considerable burden on trauma units around the country. And we felt that was an important argument to make. And in fact, that's the main argument that the government has picked up on. In terms of the counter arguments, and maybe Phil or Matt can tell me how much time I've got left. Do I have about 5 minutes?
Yeah, please continue. I think
Okay.
we're all listening very carefully.
Not too many to go. Basically, I felt there were 4 arguments that the liquor industry was likely to make, which need to be countered. One was we're seeing on TV, and it's, the cameras often like to show shots of what's going on in the communities and showing looting and things like that. And we felt that the industry says that if you open up the liquor sales, we will reduce the looting. And obviously that probably is the case. But I think we really need to get a grip of how many bottle stores were being looted. And as far as I've heard, it's 20, 30, maybe 40. It's not every single one. It's not, we have tens of thousands of liquor outlets. So it is happening, and it's not good to see, and you see it on the TV, but we don't really have a sense of how big that is. I certainly didn't get a sense from watching the footage that it's people going through withdrawal who are breaking into liquor stores. It's often the criminal elements, opportunists, people in the vicinity, the liquor stores broken into, poor people going in and stealing and thinking that's a way to make money, or they can drink it themselves or resell it. So that's a policing issue, and I think something we should be getting on top of. The other argument was that we need to open alcohol to all because certain people are having withdrawal symptoms and are suffering. And I think there's certainly an argument to be made for we need to be more sensitive to the need. And we heard some of that from Ian. Need to be more sensitive. And we're not hearing very much in South Africa, and I think that's a problem. I think the government needs to show what they're doing and that they recognize. I gave you the numbers at the beginning. If we think that about 18% of the population engage in adults, heavy episodic drinking on a weekly basis, we probably have about 5% of the adult population who would be alcohol dependent. And if we've got about 30 million adults, 5% could come to 1.5 million people who are suffering from alcohol dependence. Even if it's 1 million people, we need to be more sensitive to that group. Obviously, some of them would have purchased in advance, but many couldn't. And I think we need to look at what could we be doing. I think we need to see more health messaging support for people who are struggling with withdrawal. We need to educate people where the hotlines are. We need to make sure the emergency services are available. Counseling services are available. We know that people can go. There are 2 reasons why you can leave your house in South Africa. Basically, several reasons. One of which is you can go to buy groceries. Another one is you can go for medical services. And the third is if you are involved in an essential service, you can go and do your work. So you can certainly go to a health clinic, but I'm not sure the extent to which our health clinics are really sensitive to people going there because they're suffering from alcoholism. I think there would be a lot of stigma, and I'm also not sure the extent to which we are able to implement protocols around helping people who need medically assisted treatment, such as benzodiazepines, vitamin B12, maybe naltrexone. So I think there's a whole lot more that should be happening around. I think the government's stringent views on lockdown would also be seen as more caring if they showed a more sensitive approach to that sector of the population. Another argument that the liquor industry is likely to make is that the industry they have made is that there's a loss of income for liquor traders who are poor people. But I think the argument there is that many sectors are struggling from the same issue of a loss of income, the tourism sector and so on. So, and I think that the argument could be made that they are not a special sector. In fact, we know that the liquor sector often places a huge burden on the country in terms of harms. And my argument here is that we know that the economic costs to society are probably twice as great as there are from the benefits we get from value-added tax and excise tax. And I've been sharing an article published by colleagues at the Medical Research Council in the Medical Journal on the economic burden of alcohol in South Africa, I think a 2014 publication. So sort of to wind up a bit here, what's been happening with the legal challenge? On the 15th of Easter was around the 11th of April. That's when the Gauteng Liquor Forum implemented, or they indicated through their lawyers, quite a charismatic lawyer, Ernest Mabuza, that they were going to take the government to the Constitutional Court if the government didn't back down. The government then requested a bit more time. They gave the government only to Wednesday, the 15th of April to respond. The government said that they have a meeting of the sort of a strategy committee on the lockdown, I think on the Thursday, the 16th, and that they wanted to the 17th to respond. The Gauteng Liquor Forum said that was okay, but then they indicated that they had a new legal document that they wanted to present to the minister, which I'll share with you. And this document said that, and I'll just quote here, the impugned regulations, that's the regulations stipulating that there can be no sale of alcohol at all from on consumption or off consumption outlets, violate the rule of law insofar as they are irrational and or bear no rational connection to their supposed objective of combating the spread of the recent outbreak of the coronavirus, and that they are discriminatory in that they discriminate against poor liquor traders. But the government has a model, and in fact they've implemented a 500 billion rand sort of stimulus package, a package of interventions to help support businesses. So that's the government's counter to that one. And as I said, I suggested a number of arguments around to support the view that there is a rational connection between banning liquor sales and trying to prevent the spread of the virus. And we submitted our model. I said that the Medical Research Council submitted a 3-page report which underlined the model, where we came to the conclusion that there would be about 500 beds per week taken up by trauma units if they turned on the taps and had off-consumption sales of alcohol. And the response we got from the government's lawyers was that that supported their view that alcohol wasn't an essential product, and it supported the views of the expert scientists who they were working with. And then the president on the 17th of March, in his letter from the state attorneys to the Gauteng Liquor Board, included the following, which I'm giving to you because I think it shows South African government's stance, which perhaps it could be used to challenge what other governments are doing. So I will read these 2 quotes. In the president's letter to the Gauteng Liquor Forum, saying why they weren't going to back down. They said the government has adopted a stance of seeking to maximize the effects of the lockdown by seeking to except with regard to truly essential services. The sale of alcohol is self-evidently not an essential service. On this basis alone, it was considered that the sale of alcohol should not be permitted. The government went on to say that the sale of alcohol has proven links to an increase in violent crime, motor vehicle accidents, medical emergencies, and results in full emergency rooms and hospitals. In the face of a pandemic such as COVID-19, the experience of the rest of the world has shown us that hospitals need to be prepared to receive and treat vast numbers of COVID-19 patients and to quarantine them from non-infected patients. Oops, we'll go back to that in a minute. So in conclusion, I mean, the issue is that I think we've seen a flattening of our curve. I think the worst is still to happen. Our hospitals have not filled up with patients yet. I mean, I think that's going to happen in the next week to 10 days. They will get inundated. So the trauma beds which have been freed up because we don't have the patients going in because of drinking will be needed as the lockdown drops or goes into different phases, even more so than we've needed in the recent past. We heard last night, we also like the UK, and sometimes I listen to BBC and Sky News, and I see your secretaries of health speaking, and we have that happen on almost every second or third day. The president went on last night for about an hour, and we heard, and this is something quite different to other countries, that South Africa is going to have 5 stages of lockdown at a national level, and then it can also be tweaked so that the different stages can happen within different provinces and also within different municipalities, depending on how severe the infection rate is in those areas. So we're going to go next Thursday, at the end of our 5 weeks of lockdown, stage 5, we'll move into stage 4. We're going to move from to stage 4 next Friday, and it's been made clear that on-consumption sales of alcohol would not take place for a long time. Probably only in stage 1 will we allow people to go to a restaurant and buy alcohol. The president said last night that the sale of cigarettes will be allowed during stage 4, so from Friday next week. But he didn't say anything about alcohol products. My view, there's been some leaked documents on this, and my view from what's going on behind the scenes is I believe strongly the government is preparing to state that they will not be selling alcohol from off-consumption outlets during phase 4 either, and that this will only happen during stage 3. And I think they're preparing their response to the people of South Africa so that they can make that announcement as they go through the different ministries will start saying what stage 4 means. But I'm not giving anything away here because I haven't heard. It's just what I suspect from what I hear, but we don't know for certain what will be happening. So I think that's going to lead, in my final sort of couple of minutes of comments here, is going to lead to a legal battle. The industry is not going to accept that, and it could go to the Constitutional Court. And then, And I've been asked about my willingness to attest to what we said in our model about the return of people to the trauma units, if that comes to that. So And yesterday I submitted the journal article on our model to the South African Medical Journal because I think it needs to go through peer review. So hopefully that will happen quite quickly. My last 4 bullets here: the situation has clarified has clarified the huge dependency that many have in South Africa on alcohol and the high burden experienced by society. And I think it's not that dissimilar in the UK, although you have more people drink and you probably have less people binge drinking, but you also have a high dependency on alcohol in the UK. And in fact, several papers of mine, one on heavy drinking in Gauteng province and another on the alcohol-related mortality in South Africa, have also been given some coverage as well. What's happened has shown that there's also a lot of support in society for government's tough stance on alcohol, and it's not only from academics, people who are normally conservative. It also comes from people in the music community and so on, and the journalists, for example. It's raised the issue of, is alcohol an essential product? And the government surprisingly came out clearly and said no. And I'm surprised because the government has had quite a close relationship with the alcohol industry. Even the president was on the board of South African breweries at one stage. And there also is other linkages. So that's been quite surprising to me. And we can go into that during the question time if you'd like. And it's also raised now, finally, this is what's happening today, the issue of what should stage 3 alcohol sales look like. And I've been tweeting on this, and what will a new normal look like? And I think the opportunity has arisen where we can say we don't want to go back to the old normal. And we know that alcohol sales obviously will be permitted, but how should how should alcohol sales be permitted going forward in 3, 4, 6 months in this country? What other controls should be implemented? So there's been some discussions going on about that too. And let me stop at that point. Thank you.
Thank you very much, Charles. That's I've learned a huge amount, and one of the more reassuring things is the fact that it was a surprise to you as well as it was to me when this news came out of the South Africa's approach. It's been an extremely interesting and insightful presentation, having lived on scraps from social media. Now, I would just ask a couple of quick questions before throwing it open. I think actually when we talked about this, obviously prior to this this discussion, you mentioned some statistics in there, some quite astounding statistics in the drop in various crime rates. Now, how do you, as an epidemiologist, or how can you separate those out from other factors? Obviously, alcohol's been banned, but also so has going out of your house, and therefore perhaps some of the other conditions which lead to crimes that you mentioned in your summary have been eliminated as well. So how can you necessarily tie alcohol consumption or lack of it to a reduction in these crime rates?
Yeah, and I think that's an excellent question, and something which we had to wrestle with in the model. So there were 3 of us involved in the model building. Myself and a colleague, Richard Matsopoulos, at the University of Cape Town and Medical Research Council, who's an alcohol epidemiologist who's worked for a long time, particularly looking at he helped set up the non-natural mortality surveillance system, where they looked at alcohol-related deaths around the country from mortuaries. And the other person was Professor Andrew Nicol, who's for many years been the head of trauma services. He's a trauma surgeon at the Groote Schuur Hospital in Cape Town, which is really like a battlefield over the weekends as they patch people up from knife wounds and things like that. So the one point we had to look at in our model was, we had these 9,000 estimated, and I think we could defend that quite well, 9,000 people per week who weren't coming back to the trauma units. And we had to look at how many of them would come back if we allowed off-consumption sales. So we made the first assumption was that people normally he would buy a lot of their alcohol at bars and restaurants. We assumed that those people, if off-consumption sales would resume, that they would buy it at the bottle stores and just bring it home to drink. So those people would then consume at home instead of restaurants. But then we had to tease out, as you say, because on the one hand, I think we could say that we could see an increase in alcohol-related trauma from people bringing home and then getting into fights with the people they live with. That gender-based violence, fights with other people they live with, injury to children, that would probably go up if the taps were turned on. But many of the other forms of alcohol-related injuries wouldn't. So, for example, you're not allowed to go outside unless you're walking to the shops and you've got like a shopping list with you in a shopping bag. And when you're coming back, that you've got the receipt and the goods in your shopping basket. I mean, you might get stopped and they'll ask you where you're going. You can't just wander around and be like 5 miles from your home because the shops are closer. You'll get arrested if that happens, unless you're going to a doctor's appointment and you can show that doctor is 5 miles away. So, generally people wouldn't be walking and they wouldn't be run over on rail tracks because they're drunk, because that's generally not next door to where they live. People wouldn't be knocked down by cars as much because there are much less cars on the road. Drunk driving would go down, although people will be drinking and some of them will be driving and they may drive faster because there are less cars on the road. So we didn't have all the data. I mean, no one's done research looking at the effects of lockdowns. There's been a little bit of research done in places like Greenland when there was a drought on alcohol, but we couldn't really get all the information we needed from those kind of situations. So in the end, we had to have a discussion, and we had 3 kinds of injury types that we looked at. We looked at violence-related injuries, traffic-related injuries, and other. And other comprises falls, self-harm, being injured on railway lines, poisonings, alcohol-related poisonings. And we had to go through each of those and say, if people are able to buy alcohol, normally we would see so many coming to the trauma units per week. How many won't come because of the environmental conditions? We assumed that for violence, that people would be drinking. Some of them will drink quite a lot and they will go outside. They're not going to obey the lockdown and they will inevitably get into fights, and some of those will come back. So our assumption for that, I believe, was about 70% of the violence-related injuries would recur. But we said that of the traffic-related injuries, only about 10% would come back because there might still be drunk people walking around. Some of them might be hit by cars because there are a few cars on the road and they might be driving fast because there's no other cars on the road, but most of it would fall away. So we said that 90% of the traffic-related alcohol trauma visits would fall away, and you only get 10% coming back, and so on. So it ended up being almost like a Delphi approach where we debated each of it until we could reach a consensus where we agreed. Not a very exact science, but we felt that it was quite defendable to a point. We ended up being conservative in terms of the consensus point, and then I fitted a 10% drop and a 10% addition around those confidence interval in the journal article, at least, that we're writing. So we said it could be 60% of the alcohol-related violence trauma would come back, or maybe as much as 80. So that's a long answer to your question. I don't know if that
it's a very difficult question, so it's quite reasonable that it should be a fairly long answer to it. There is a question from Janet Goran. Hopefully Ben can identify. If you switch on your camera, Janet, then it'll help. There we are. You're on, Janet.
Okay, hi there. Thank you so much, Professor. That was absolutely fascinating. I'm also in Cape Town. My name's Janet Gorond, and I run an organisation called World Without Wine, and we work with people to help them quit drinking alcohol. Now, we heard last night that the cigarette ban is going to be lifted, but he was rather evasive about the alcohol ban, and I'm so worried that it will be lifted because it seems like we're really making progress. We've created all this space in the hospitals, this amazing 2/3 drop of trauma admissions. Our curve is just beginning to climb, and this is absolutely the crucial time to have that space available to help people. So I wanted your view. I know that you're trying hard to make sure that it does stay, but I wanted your view about whether or not the president is going to lift that ban.
Yeah, I mean, I was quite surprised. He said that tobacco, well, you can buy it at the stores where you buy your normal food, so you can buy it there. He said that alcohol will not be allowed for sale on consumption venues. He avoided the issue about whether alcohol could be bought for off consumption. My reading of this is, he has a committee, particularly the Minister of Health has a ministerial advisory committee, and many of us have seen the excellent presentations, and the head of that committee is someone I know very well. I've worked under him on 2 occasions, and at one point was 17 months, and we worked together on a daily basis. Professor Salim Abdul Karim, who's also a member of the Royal Society in the Royal Society, which shows his stature.
Yeah, he's fantastic.
And, I know he's thinking quite well, and I certainly know that my document has reached him through a number of avenues, and I'm in contact, with him. And so I can't believe that his advice wouldn't be that in stage 4, we need to keep those hospital beds. I think the government has made a few concessions around tobacco. I think you could argue that tobacco also should be banned, because I think if it's less available, even people who are heavy smokers, their lungs will improve to some extent, even in the short term. So their ability to fight the virus will improve and their outcomes will be better. There's an amazing study I've done in I think, 30 provinces in China, which shows that. But I think there was a feeling that they had to give something. I mean, they've given into taxis being able to, I think, take 7 people, which probably also doesn't make sense from a public health point of view. They allow people to go to funerals out of the province, which also probably is not a good public health move. But I suspect that they're just biding a bit of time so that they can strengthen their legal case. The fact that I was asked would I be prepared to support, continue with the affidavit, makes me think that that's maybe the direction they're taking. But obviously one can't presume that the president could make up his mind differently. But I think that when we're hearing a lot of the economic issues today, that how the money's being spent. And I think over the next few days, the government will be presenting, the Minister of Health will probably present the case for why the liquor ban needs to continue during stage 4. And I think they're gearing up for a legal battle around that. So that would be where I would put my money. So I think, and I'd be interested, Janet, to hear what the people who work with you, the people who are doing those courses that you offer, how they're doing and how they're finding the liquor ban. Is that helping them? But maybe I shouldn't be asking my own questions at this time.
No, please. Actually, that was a question I was going to pose myself. So I absolutely fully support you in answering that if you can, Janet.
Sure. Well, I think, amongst our community, people that are still battling with the drink and drinking quite heavily, I fear that they might even be drinking more in this stressful time. But people that are getting a grip on it and are managing to stay sober, people that have been sober for maybe a month or 2 when this lockdown started, they're finding it enormously helpful because they haven't stocked up and they're just finding it's almost like being in a detox, and it's turning out to be a positive thing for them. And people are, working online more to support each other. We're having weekly Zoom meetings with people, and helping them to get through the isolation and the temptation that some of them still have to drink.
Well, that's a really interesting point you make. I think there is a tendency to assume that this is going to be, the challenge of this situation would necessarily be difficult. But having said that, there are some benefits, particularly if you live in a country which is removing temptation from your clutches. And we have another question from Adrian and Jenga, if Ben could pick him out. You're on, Adrian.
Thank you, Phil. Evening, everyone. At least it's evening here in Kenya. Professor Charles, that was quite an insightful presentation, and coming from East Africa, I could relate to many of the challenges that you were experiencing in South Africa. And I'm quite fascinated by the pushback we are getting from harm reduction activists with regards to a ban on alcohol sales during this season. I'm finding that quite fascinating. Even here in Kenya, there's a lot of pushback from this category of health professionals. Excuse me. My question, though, is from the observation since the lockdown. Have you seen an increase on adolescent alcohol use? Is there any data to indicate whether that has been on the increase or that has declined? Because I understand with the lockdown, even schools have been closed and children are at home. Then secondly, maybe this is a question now to everyone, including Ian, is have we seen an increase in the number of admissions in the treatment and rehabilitation facilities during this period? Here in Kenya, we still don't have a lockdown. We are operating with a dawn to dusk curfew, but we are now starting to see an emergence of people who are coming out to ask for help. Because as Janet pointed out, we are living in an anxious period. People don't quite know how best to deal with the stressful circumstances that they're dealing with. So alcohol and other drugs are becoming a maladaptive approach to dealing with this situation. So yeah, over to you. Are you seeing an increase or a decline in the number of adolescents who are using alcohol? And then are we also seeing, what are the numbers like in as far as the treatment and rehabilitation facilities are concerned? And has government also issued guidelines as to how this situation can be dealt with? Are people allowed to be admitted within these facilities? And if yes, what kinds of COVID-19 prevention strategies are being adapted within those particular settings? Thank you.
Excellent questions, and I don't have all the answers. I only have a few. About adolescent alcohol use, we really don't know, and it's not even picked up by the media. Obviously, they've got to get access to it, so people are confined to their homes. So it's only if their parents are sharing it or they're taking it. But obviously, if they're living with their parents, they would see what's going on. I think that's a very good question. I mean, some of my colleagues in the Medical Research Council are busy as we speak finalizing a research proposal to really find out what's going on. I think in the UK, you're better off. I mean, at the beginning, Phil presented a little bit on the research findings. And I think, as I understand it, I think there's a section in the UK who are dropping moderately, but I think a third of the drinkers are drinking more. And there have been some surveys, but we haven't heard of any of the surveys in South Africa. Our population, a lot of people perhaps can't be reached. We need to be able to access their cell phones, and not as easy to reach people, but we are hoping to undertake that research very soon. I think research proposals are being funded now for COVID-19 very quickly, and they're being reviewed and ethics approval given. So certainly we hope to be able to answer that within a month or so. We just don't know. I also don't have a good sense of what's happening at treatment centers. Treatment facilities, obviously, I think many of them have gone online, and that would mean that they're not available for everybody in society, because not everybody has got unlimited data. So I suspect many people, the availability of services is less than it was before the lockdown. So I don't know if anyone else wants to chip in here who may know more.
I think that was it was also posed to Ian, whether Ian is able to maybe even on an anecdotal basis find out perhaps about the adolescent drinking in the UK, whether there are kind of Zoom sessions going on in these strange times or not amongst adolescent drinkers.
I agree with Charles. We haven't got the data yet, but what I would add is to Adrian's other question about hospital admissions, is there has been a concerted effort to clear hospitals of people who, just make room in NHS hospitals in the UK to clear the way for COVID patients. And the estimate is that 5% of UK hospital beds are occupied at any one time by people who have alcohol problems, dependency, and etc. Now, 5% doesn't sound like a lot, but given how big the NHS is in the UK, you're talking about thousands of beds. So the other concern I've had recently is, although the evidence supports community treatment for alcohol detox, there isn't the workforce there to provide it. So we've got a double whammy at the moment where hospital beds are being cleared. I don't mean people with alcohol problems being thrown out, they're just not being admitted. But they're being left without any treatment, essentially, in the community.
It's very interesting. I have another question from the Global North. Peter Rice, who's found the hands up button.
Okay, hi. Thanks, Ian and Charles, for really great presentations. And I think the fact that Charles is going ahead with submitted publications and so on, that's going to be so useful, I think, for the international community and and what we can learn from this. And I was really struck that the case in South Africa hasn't, about alcohol not being essential, hasn't really been made on a kind of philosophical basis. It's been made on a very pragmatic basis of health harm, demands on hospitals, all the things we heard Charles talk about. So I think that's been a really interesting thing to hear, because it's been a bit absent from debates, I think, elsewhere. So in other words, that the alcohol harm that everybody kind of accepts isn't inevitable, and that's, I think, the really interesting thing about what seems to have happened in South Africa. People have taken a step back and actually looked at what's a very familiar lot of harm and said it doesn't have to be like this. So that's, really interesting. But my question for Charles is that, you were saying what's going to change when you come out of this. Would you like the unregulated bit of the industry to be regulated? Is that one of the things on your shopping list, to try and get the shebeens and so on into a regulated framework with all the advantages that can bring, or is that too much to ask?
Okay. Certainly, and we're thinking about this. The South African Alcohol Policy Alliance, and even people from the Western Cape Liquor Forum. There is a discussion. Even today, there was a discussion about for stage 3, which we've got this nuanced phase, which is probably going to happen over the course of the next 6 months. Would stage 3, should we be saying that there will be limited hours for off-consumption sale in stage 3? Should we also be saying there should be like quotas on how much you can purchase? And one of my views here was we should be wary of making it too complicated. What we want during the lockdown, we should be asking for what we want afterwards, and put forward quite sensible arrangements so that we can evaluate them, and afterwards we can show, okay, if you have sales, off-consumption sales between 9 o'clock in the morning and 5 in the afternoon, that's sensible. It doesn't need to be made later. And then later on we can make arguments for on-consumption sales to stop at, say, midnight or something like that. So I've put forward some suggestions in the media around what should happen, and I certainly have been on committees and arguing that we need to bring those unregulated outlets into the regulated market. We need to have fewer of them, so only some of them should become regulated. Some of them will never become regulated. It's someone's home, and they just push the beds apart and they make a little liquor outlet on the weekend. Those should never be proper liquor outlets. But I think we need to bring more of them on and then make it a regulated industry. So that is one of the recommendations. Other recommendations are, we have many pieces of stalled legislation which haven't gone anywhere, often because of liquor industry pushback over the last few years. One idea was to put a 0 level for drinking and driving, 0 blood alcohol concentration. So I'd like to see that put on the board. I mean, I'm an alcohol consumer, but I think we should just separate drinking and driving. And so then it's you're not trying to calculate, well, I've been there for 3 hours, can I have 2 drinks? And how big is my body mass? And I'm male or a female? Just separate that. So I've been arguing for that. Another proposal as part of our liquor amendment bill is to raise the drinking age to 21. I think that's perhaps something we could argue for. They have it, it's certainly pushed in the States. I think we should be more pragmatic and perhaps go for 19, which is when many people finish school at 19, and then see how that goes before pushing for 2021. So I think there is some room for some pragmatic discussions around that. I think there's also a stalled legislation around marketing, and I think we need to look at that and have much more controls on alcohol marketing. And I think we're going to use this door that's open because the government says it's not essential, to try and help them to move forward on some of the stalled legislation. And the other thing is around minimum unit pricing. And it's interesting that Scotland, Wales, and I think there's some other island that has it now. Jersey, that's right.
Jersey, yeah.
Hot news this week, Jersey.
Yeah, no, yeah. Phil found that out. Yeah.
That's very good. And then we're working with colleagues at the University of Sheffield. I have a PhD student there who's helping us look at minimum unit pricing in South Africa. So I think that's something we need to look at too. The very cheap alcohol needs to be made less available. So I think we will be trying to open the door with scientists and researchers, plus advocacy people from the Southern African Alcohol Policy Alliance and others, build this coalition, and maybe Janet, we can get her on board too, and we can kind of push some reforms in these areas while we can.
Okay, thank you very much, Charles. Do we have any more questions from any maybe people who haven't spoken yet? You can switch your camera on, or if you can find the button to put your hand up, do that. my colleague Ben will pause the screen. I think maybe I can I possibly ask Peter, since he's just been on, maybe you can, you've obviously been watching the situation in the UK over the last few weeks. I don't know whether you've come to any sort of conclusions about what the way things are shaping up and the way that the government's approach is shaping up. Are there anything more that can be said now?
Yeah, I don't have much to add to what Ian, who I think has now left us, maybe was saying earlier, that it does look like this pattern of the light drinkers drinking less and the heavier drinkers drinking more. I think there's some indications from New Zealand they'd seen the same trends. The pubs aren't going to open for a long time. I think that's becoming clearer and clearer. They're going to be one of the last things to reopen. So yeah, I think not much to add to what Ian said. I do think it may give us a chance to look at online supplies and online delivery systems that have been kicking around as an issue, pre-COVID, and I think it's sharpened that issue. So at the moment, so we have the anomalous situation where to get a license to be able to sell alcohol in a pub, you have to undergo a training course and so on and so forth, something that the publican's been very supportive of. The same in off sales, you have to undergo training. But for online sales, it's the delivery driver who's the regulator, and what training will they have had there? Mm-hmm. So I think actually that's really going to highlight that issue, I think, very, very effectively. So I think probably not much more to add to what, and the other things that Elena and Jordan fed back from Scotland earlier. So I think we're going to be a long time before we see pubs and restaurants reopen, but I don't think we're going to see any change in regulation of stuff. Just as far as the treatment independence goes, a few agencies, including Scottish Health Action Alcohol Problems, which I'm involved with, have put out advice to the public on self-management, really because, I think Ian again said this earlier, alcohol services really shut down pretty quickly, particularly the ones that might rely on home visiting, so the kind of traditional nurse coming in to see how you're getting on the home detox services, they shut down really pretty early. And we've had good feedback about the self-management advice, and I hope people have found that helpful. So I think those really would be, I think my observations of where we're at and where we're likely to stay, I think, for a good few weeks yet in the UK.
Can I ask you a question, Peter?
Yeah, sure.
Two questions I think are crucial. One is South Africa so different that it's understandable why we have a different view of alcohol and different lockdown provisions to the UK? Are we so? Yeah. That's one question. The second is issue of inequalities that's been raised quite a lot around how it's unfair because those of us who are middle class were able to buy in advance, and so it goes both ways. And so the poorer people are those weren't able to stock up and have a supply, and then the other way around is that after 5 weeks, many people could go to the shops and could buy 3 bottles of wine and bring it home and have 1 glass a night, drink responsibly, but they can't because the argument's been made that in the poorer communities people won't drink like that, and they will gather together because of the housing situation, and that we will end up with this huge surge. So I think most of the surge in trauma admissions is going to come from the poorer communities, although obviously there might be some gender-based violence and self-harm, those people coming from the more middle class and upper classes. So there's that inequality argument too.
Yeah, interesting questions. A few thoughts on that. Firstly, I do think the amount of trauma work that you describe in your hospitals in South Africa is higher than we have here. So people will be fed up here and go to Scotland, so many Scots on this call. But yes, our figures are less than 10% of trauma work overall is alcohol related. Now, it's of that work, a lot of it is Friday and Saturday night, so it tends to be kind of concentrated. If you look at Monday, Tuesday, Wednesday, there's actually not very much alcohol-related work in UK A&E departments at all. So that does sound like your trauma work, including road accidents and so on, is at a higher level than ours. So I think that is one thing that makes it different. On the inequalities issue, and again, I think maybe Scotland's different from England on this. I think there's a good understanding now amongst policymakers that the effects of harm from alcohol is unequal, and actually, if you just kind of let things run and don't regulate, then it's the lower income people who suffer from that. So I think we managed to get to a point where we've got quite a decent understanding of that actually it's not just the access inequalities you were talking about, Charles, there's the harm inequalities, and that, I think some decent evidence now that good alcohol policy, particularly benefits people in those lowest income groups. So the inequalities argument still kind of kicks around, but I think we've managed to, get people to understand that actually effectively, reducing alcohol harm is a benefit to the most deprived communities who experience the most harm. So I think those would be my thoughts on those questions.
And that's also, I think, been picked up by the government's lawyers as an argument to the discrimination issue, that in fact that the benefits will substantially more accrue to the poorer communities if there's a lockdown. So even though it could be seen as discriminatory to the people who sell the alcohol, who make a living from it, the benefits will accrue substantially because the community transmission won't go up, injuries won't go up, and so on.
I was just wanting to look at the statistics in the UK, which clearly I think they've actually been reflected to some extent by some statistics from New Zealand about the heavier drinkers, potentially people with some degree of alcohol dependency, are drinking more in this situation, and actually the others are actually, because Janet has suggested, in some ways finding opportunities to rethink their habits. And as somebody who's kind of looked at it as a non-specialist outsider, one of the things is the fact that people don't necessarily know that they have an alcohol dependency, or they are suffering from withdrawal symptoms. They may well put these things down to other effects, and obviously this situation is confusing enough for anyone. And how can we actually target some useful advice and support at people who are potentially suffering alcohol withdrawal symptoms, anxiety, depression, emotional instability, without actually realizing that this is a contributor to their problems? Is there a way that this advice can be formulated? To Charles, I think Charles mentioned this was an area which is perhaps lacking a little bit at the moment.
Yes, I'm not going to answer that. I certainly think that, and I certainly made this clear to the government's lawyers, that as part of their response, they need to show that they're show an understanding and the resources are going into this sector. Because I suspect that many of these specialist substance abuse treatment programs are actually closed during the lockdown, and they should be reopening in this next stage.
Mm-hmm. And Peter, I don't know whether, this kind of grey area drinker, I suspect a lot of the people who are drinking a little bit more in the UK, or a lot more possibly, are not people who necessarily consider themselves people with alcohol issues. Is there any way we can use this as an opportunity to sort of root these people out and help them perhaps use this as a positive opportunity to address this issue?
Yeah, I think so. But, of course, one of the questions, when I was in clinical practice, I used to sometimes annoy planners of saying this, well, how many people do you want in treatment? If they all came to treatment, you need to invest an awful lot in services. So I think, that's one of these awkward questions that always kicks around. Alcohol dependence probably has the highest unmet need of, it'd be hard to think of a health condition that has more unmet need than alcohol. There was some work that Colin Drummond's team did in England that showed that I think it was less than 6% of the need was being met. So there's a huge treatment gap. It'd be great to close that. Some countries are much better than others. So yeah, it would be, of course, it'd be wonderful to have all those people coming into treatment, but actually the system has never been designed to do that, and we need to actually ask that awkward question, I think, of planners. How many people do you want in treatment? But in terms of the general advice thing, again, without wanting to annoy people, we were fortunate in being able to get the Chief Medical Officer and First Minister to mention alcohol as a kind of general issue, along with exercise and other things, including actually advice not to watch the news too much, which was an interesting thing. That that for people's sake, people's mental health, they shouldn't be focused on coronavirus issues all the time. So the alcohol issue was kind of couched in those general well-being terms, and I think that's probably about the best that can be done at the moment, is to have it in there as I say, a sort of general well-being issue. But I do hope that some of the issues that coronavirus has raised about the shortage of treatment services helped. I mean, just to finish off I absolutely support Charles's view that if you're doing what might seem like the kind of mean stuff on price and regulation and access, you also have to do, and it's the right thing to do, of course, and it's anyway, to do something on treatment and help. So carrot and stick going together, I think, is the ideal situation here. So yeah, I think those would be my views on that.
Okay, I'm going to ask, because it can so much Zoom and one starts to feel a little bit lightheaded. So if anybody has another question, then please speak now or
Phil,
flash
could
on
I
your,
come in? Sorry, Phil.
Yeah,
No from Scottish Recovery Consortium. I'm aware of the time. On a related point to what Charles and Peter were discussing there, I've been wondering, given the polarisation, obviously we touched on this grey group in the middle and the people moving towards abstinence and people increasing their drinking. And given what we've heard today, that seems to be an international pattern, maybe even a global pattern in a sense. I'm wondering, as we move out of lockdown in a phased way towards the new normal, as it's being called, is there an opportunity in terms of prevention and education, a whole population approach, when drinking behaviours have been interrupted or changed by this situation? Do we have a positive opportunity to readdress whole population relationship or perceptions of where alcohol sits in life? Should we possibly be mindful of that in terms of a prevention, education, whole population approach? Being mindful of introducing the whole of society to the benefits of a life without alcohol.
Mm-hmm. No, I think that's it's something I touched on. I think when we first met, the COVID-19 outbreak has been so obviously to our benefit to change our behaviour that it does and has been so popularly received. It does open that question as to whether or not public health messages are necessarily are unpopular. I mean, we've actually welcomed the fact governments have been taking often quite stringent measures to protect us, and also the World Health Organization, in terms of alcohol, have actually issued some of the clearest sort of suggestions in terms of reducing our intake to a minimum and avoiding amounts which might compromise our judgment or our immune function, which possibly is the clearest advice that has emerged from any kind of sizable institution into the public domain in recent years. So from my point of view, as somebody who sort of covers this area, has been quite refreshing. I don't know whether Charles or Peter possibly might have some thoughts on that.
I'll pass for that.
Okay.
Yeah, just quickly for me. Yeah, I think the WHO, guidance was really good and clear. And yeah, I think a lot of sympathy with what Jordan was saying, that it's maybe a chance to reset. Ian has written, I think, very well in the British media about just what does it really mean about us when we regard alcohol as being essential, and I think that has kicked off some debates and some awareness. So I do think there's something to build on there as we get into the post-COVID recovery thing, because I think there's a general acceptance now, that a few people have said it during this session, that we're not going to be going back to things as they were, and in fact, the Scottish strategy is called Changing Scotland's Relationship with Alcohol. That's been the strapline for the last decade. So I think it does give us, and globally, it does give us a chance, I think, to reset our relationship. So that's going to be part of the work, I think, that we'll all be involved in over the next while, I hope.
Yeah, and I think also what's happened in many countries is politicians now talking to scientists, which is something we don't have enough of often. So I think those relationships will be there, and I think certainly my experience, I know what it's like for those of you in the UK, is that it's opened up doors. It's not every day. I have special advisors to ministers and the Director General phoning me, asking me for advice, and I'll certainly use those contacts. I capture their phone numbers, and I won't be shy to send them WhatsApp messages, because we use WhatsApp and stuff like that. So it's opened some of those direct doors, some of the back doors as well. And the media, I've been quite surprised at a couple of people in the media. We've got a group called, sort of health journalists, who actually don't just bang out these short articles which say the same thing. They actually include evidence. Conversation pieces are being written. There's a thing called the Daily Maverick, and some quite nice relationships are building between the scientists and the media, scientists and politicians, which we need to certainly build on. And we're hoping to host the next Global Alcohol Policy Conference in South Africa in October next year. So certainly we want to capitalize on what's been happening around the COVID-19 crisis.
Well, I think this is a very, very good point to maybe wrap things up. There's only so much Zoom conferencing one can do in a day, but I thank everybody for turning up. There's some positive things in this still rather confused and overwhelmingly sad situation, but we can hopefully move forward and use this as an opportunity for positive change, as well as overcoming an inevitable negative. So thank you very much to everyone, and particularly to Ian and to Charles speaking, and to Ben, who's conducted operations from behind the scenes using the conducting skills that he's so well trained in. So thanks to everybody who's presented, not everybody who's asked questions. It's been a pleasure to host it once again.